Thank you, colleagues. What a privilege, and my gosh, how time flies. It feels like a family, and it is a family. But because it's a family, let me start with something sad, in addition to Carol's own sad news about her mother, and Vanessa, to also acknowledge that very recently you lost your dear father. We also lost people in the nursing family. We lost this year Joe Flaherty, who many of us were extremely close. Jero Guerrero, again extremely close. Josie Santos, our own staff. And then also just a couple of weeks ago, Doris Grinspun. So for them, our hearts, and for them also these remarks alongside us for you, because I know that they all, each and all, will feel extremely proud of our accomplishments. Let me begin by saying that this is a talk to bring us together on where are we moving, who we are, and how do we do what we do. So suffice to say that today, after all the remarks of the parade of politicians yesterday, which really does feel like a parade of politicians, with a room that was more packed even than last year, that was our 90th anniversary, we can say proudly that we are the professional association that represents registered nurses, nurse practitioners, and nursing students like no other one that I know, or quite frankly, that anybody knows. We are the credible voice in Ontario for RNs and peace and nursing students in any matter that relates to healthy public policy, including nursing matters specific to the profession. And for that, colleagues, we only have to thank you. Because if you thought that the many announcements, and yes, I was surprised because you always do a whole list, but you never think you will get the whole list. And we got the whole list. For that whole list, the thanks go to you. Because without you actually driving the agenda and also moving the agenda, no voice at home office or at the podium of the president or behind me with the board will suffice. It is the members that have given through the years the power to this association to actually mobilize the political will to produce results. So the ends that started at the time of Shirley Sharkey and continue with David and with Rhonda and with, I believe, Charlotte is here, and I hope I am not missing any one of my 10 presidents or 12. You need to take a lot of pride because they have been shaped, but they have not been changed. And it's because they have not been changed because they're driven by values. Engaging nursing, RNs, and peace and nursing students to stimulate membership, not just for the sake of membership, but for the sake of actually driving those values into action and into results. Advancing the role and image of nurses, which we have done beautifully. Speaking out on emerging issues when no one else wants to speak and when it's not convenient nor comfortable, and influencing by that healthy public policy from social determinants of health to environmental determinants of health, to when the system breaks down because we didn't respond to the first two, to have a health system that can respond to people, and within that, to have a strong nursing profession. So how do you move from visions to realities? How do you move from dreams of a board to actually deliver on results? Well, you learn from the past, but you do not stay on the past. You act on the present, and yet you don't stay in the present, and you then envision the future, and you create the necessary bridges all along to actually create a brighter future, as I have said to you in years past, not only for nurses, most importantly, for the people we serve. So what does it take? You heard Vanessa saying yesterday at the podium, and I will repeat it today. First of all, it takes a foundation of values, very, very clear values, which this association has had for over 100 years, even before it incorporated, and certainly has it today. It requires the evidence to be able to argue those values and drive them into the reality. And then it requires a huge dose of courage. That is the type of courage that this association, your RNO, has. That is what differentiates RNO from so many others in the world, and why they bring us all over the world to actually try to insert some of this capacity. I just came back 2 days ago from the SRNA annual meeting, where they asked me to be the keynote and bring actually what are the recipe for success. And I said the recipe for success is unleashing the power of nursing, unleashing the power to speak with values, with evidence, and with courage. So let's talk about leading with values just this last year, because after all, this is not a 20-year report, Madam President, so be assured I will not be here for an hour. This is only about this past year. And I'm going to show you images of yourself for you to look at the mirror, whether you are in this picture or if not, this evening when you go to your room, and to understand that it's you that has the values, that is you that has the evidence, and that is you that has the courage like no one else. And that makes me so very proud. So whether it is from taking your MPP to work, which we started about 18 years ago together, that has grown immensely, where you have taught politicians what does it mean to work as a nurse, where you not only have spoken with them, but have shown them with your hands, with your feet running from one room to another, and with your tremendous mind, what does it take to take care, whether it is of a homeless person in the street, of a woman in danger in a shelter, or a person in a home, or a very sick child in a hospital, or anywhere in between. What does it take to teach the new generation of nurses? What does it take to do research in nursing? What does it take to manage health human resources, especially at such difficult times as now? Or where you take Queen's Park on the road and you visit your MPPs in the local ridings, which is, again, an amazing, amazing initiative that RNO started years ago. But we could have started so many things. The beauty is that you embrace them all. Or where it is the visit at Queen's Park, that we then, after we have those wonderful breakfasts, we sit in the legislature and we simply enjoy listening how they introduce one member after another, and how one politician fights over another to actually bring your names forward. It's you that has made this happen. Leading with values starts with members, starts with boards, starts with staff, starts with knowing what is it that we are all about, where is it that we are going, and why is it that we are going there, not just how is it that we are going there. Speaking with values means a president that knows what matters. That's you, Madam President. That has the courage to say it the way it is, that has the belief on where we are going, and that has the knowledge to be able to say it the way it needs to be said. Leading with evidence is the type of program that my colleagues and I and you and all of us have developed through these evidence-based guidelines that are all over the world. And let me tell you about this all over the world, because from time to time still there is that little noise that says, why is RNO outside of Ontario? Because it will be selfish not to, colleagues. It's as simple as that. Because knowledge doesn't belong to us. Knowledge belongs to the people that need nursing services, wherever they are, whether it's here at home, whether it's across Canada, or whether it's abroad. So with that evidence this year, new guidelines developed, new guidelines were revised, and new guidelines are on the way, and we will continue. The beauty with the program, it has evolved into this magnificent program that now is nursing-led for all professions, because not only nursing is benefiting from it, but actually every single other discipline. Leading with evidence is the type of educational programs that this association provides its members and also non-members, whether it's webinars, whether it's workshops, whether it's institute. Thousands and thousands of nurses attend the activities, the educational activities, capacity building of RNO, whether it is NELA, the Nurse Executive Leadership Network, or whether it is on best practice guidelines, or whether it's in wound care. You have it all to ensure that your practice is the best that it can be. Thousands of nurses that attend, for the most, for free. So, partnerships, many. Partnerships with Canada Infoway, partnerships with governments, partnerships with CNA, partnerships with CPSI, many, many partnerships that we are doing and providing our expertise to develop joint activities. So today, we are influencing over 500 healthcare organizations and educational settings across the world. 500 of them. Just picture how many thousands and thousands and millions of patients are being served by that. Leading with evidence means that you also measure. And for that, we have acquired a data system that has become so powerful, robust, and important that the advisory, the international advisory, wants us not only to use it for BPSOs, but actually, I guess they told me that I'm done. Madam President, my battery never runs down. I'm reading there, your battery is running low. Never, never, I can assure you of that. And if you try me too much, I may stay for hours in the mic just to prove it. In any case, do not worry, we can continue without slides. So, the data system that Judith Shamian, the president of ICN, is actually the person that chairs the international advisory, a data system that is measuring the outcomes of guideline implementation of BPSOs on patient, organizational, and system outcomes, where actually organizations receive now reports every 3 months where they can compare themselves to others, where they can sit now with the staff and look with the staff at what is their practice actually producing for patients, organizations, and the health system as a whole. No worries, Sarah. It's all good. So, let's see. Here we go. So it doesn't stop, though, the evidence with the guidelines. It doesn't. If you look at the work of policy, and you heard the minister yesterday speaking about ECHO as if ECHO was its own report. And it is in a sense, because putting patients first, much of it actually derives from ECHO. And you will hear more about that because I have the next phase of ECHO and the next phase of the minister's report, which I spoke with him already yesterday about that. So it is evidence that makes all these reports to stick. It is evidence, the reason why a minister will say to me, if you get any block on anything, speak with me, because as long as there is evidence, we are moving forward. And then we don't just stop there, we bring evidence into policy all along. So for example, activities between the best practice guidelines program and policy. And again, the minister yesterday spoke about this, because it is not enough for us that we produce a guideline on wounds for people with diabetes, where in this country you can pay $70,000 to have an amputation, whether the system will cover $70,000, but then the system will not cover $100 of an offload device. That is what the minister was promising yesterday when he said, be assured there is already a committee. But be assured there is already a committee. It didn't just happen. It happened because after the premiers across this entire nation chose the guideline of RNO on foot ulcers for people with diabetes, 2 years have passed and they have done from coast to coast to coast nothing. 2 years where 2,000 amputations right here in Ontario, 80% of those could have been prevented. 2 years where 2,000 people since then have lost limbs and have suffered terrible situations unnecessarily. 2 years where we have spent money that could have been better spent. So yes, next year, I'm quite confident that I will be standing here and saying to you, yes, they are covering offload devices, and yes, it will be the first in Canada, and yes, then the rest of the country will happen. And that's where we partner with our colleagues of Diabetes Food Canada, with whom we also have a joint journal online. And not only we partner because they adopted our guideline, not only we partner because we met with the minister and his staff, not only we partner because we met with opposition leaders, but then we use our own Queen's Park on the Road to do their Queen's Park on the Road. So we had a mini version just a month and a half ago where we had people with amputations speaking to the media and speaking with politicians. And so then we sent a very clear message. Either this province will cover offload devices, or in September, we are going to do a massive press conference to actually put the numbers out again to the public. It has been well covered by the media, and it will continue to be until the funding comes through. And the same is the case on safe injection sites. I know that here in the audience are many, many of my colleagues that work with people with addictions and mental health. What I keep repeating, including to my own colleagues that send from time to time, few in between, but from time to time, I hope you will be outside, Doris, when people will be taken to the police because they're injecting drugs. We need to understand, colleagues, that drugs and addictions, whether with mental health or without mental health, is a disease like any other disease. We need to open our minds, we need to open our hearts, and if nothing else, let's just open the books and learn ourselves. because I was there where we were going to present to the Toronto Public Health Unit, and Carol will be very proud if she was here, and many of her colleagues are here, that is taking the initiative forward to have 3 supervised injection sites. When a mother spoke about her daughter, when a mother spoke about her pain with the daughter, and then she said, but you know what? I was actually one of the lucky ones, because as strange as I was from my own daughter, before she passed away, I made peace with her and I learned from her. How can we stand and sit and listen to experiences like that and not understand that people with addictions can be, number 1, saved from overdose, number 2, helped by feeling human beings? And how can we not understand that if we don't do that, we are harming not only them, but our own very communities? So be assured that next year, when we are standing here, because we will be standing together at the podium with Carol and myself and all of you, we will be saying, we help make it happen. And we don't stop there either. We don't only bring evidence to policy through documents and through guidelines and through advocacy, we also bring it to the media. Every single piece of journal that you get has intentions. There is absolutely nothing in the journal that just happened. You may not know the stories behind always, but always there is an intention. So the one on the right at the top is when we wanted to show that having refugees from Syria is the right thing to do. That having refugees, whether from Syria or somewhere else, is the important thing to do. That we are not just citizens of this province or citizens of this magnificent country, but we actually are citizens of the world. That what happens wrong far away affects all of us together. So that journal portrays your work in working with refugees. And the work that many of you have done with us at home office, with webinars, it's your expertise, and it's you that is helping us move these agendas forward. So leading the way, though, it's not enough to have values, and it's not enough to have evidence. Because without the courage pill, actually, all of this will be books, will be reports that will stay in the shelf. That's where most nursing organizations, not only in this country, but across the world, fail. Wonderful documents without the courage to give them life, to move them to the finish line. That's where people like Carol that went to the March on Justice, Jobs, and Environment play a role. That's where people like Vanessa Burkowski that stand with the sign of why will I vote play a role. That's where your board members have the courage like no other boards that I have seen. And I am speaking about my board this year, but I am also speaking about previous boards. So leading with courage is you, whether in the streets of power or whether in the streets of protest, whether the Leanne Siracusa with signs and marches about poverty, or the Cathy Crow going to places and showing us in our face what homelessness means, or the nurses in Hamilton that went in march and in mass on the layoff of RNs at St. Joseph's NICU. And that is what gave me the tools to actually write and call the minister and say, you must stop this. And that is what gave me the power when I was asked to wait for a couple of days to have a comprehensive plan, to say not even one day. It's you that energizes, invigorates us, and gives us the power to move things forward. Whether it's on refugee health, that we did turn the decision of then Prime Minister Harper, and we did actually, because of Justin Trudeau, now don't need to fight in court. And yes, we had secured, RNO was the only organization, nursing organization in this nation that decided to take on Prime Minister Harper at the court with the refugees. Luckily, we didn't need to find more time to waste, because waste would have been, but you do what's right. You do what's important. So whether it is on moving policy like nurse practitioner compensation that was announced at our last Queen's Park in February, side by side with that afternoon, the budget, or whether it is on stopping current replacement, whether it is on environmental or social determinants of health, all of it, we take it on. So leading with values, evidence, and courage, how is it that they will not do it? Just look at the example. We met with 102 out of 107 MPPs this year. 102 out of 107, and that's year after year after year. We had 11 candidates debate for the federal elections. We had, just on 5 of the action alerts, over 20,000 members responding. We have 23 submissions, and we had 4 pre-budget deputations. So just picture, I need you to understand this. This doesn't depend, really. The only thing that depends on these people is to have the vision. But no one could move that vision if it was not for you that are doing these activities. None of us could do that level of activity, and that's the power of what makes us move. That's the members are taking over. And let me tell you one little piece. When I started at RNO, if one of you, given that my president mentioned the 20 years, one of the journal staff did an interview, and they asked me about what I wanted to achieve with RNO. At the time, I said that the problem of RNO was that no one owned the association. I said, not their board, and I had been in the board, not the members, not the staff, no one owned the association. What I can tell you today with certainty, number one, owns RNO. You have a board that provides fiduciary oversight like no other board. You have a board that has the strength, evidence, courage, and values to drive the agenda. You have members that own the organization and take it on and give it life like nothing else that I have seen. And you have a committed group of staff that gives you the expertise to be able to do the work. So whether it's in the media, whether it's in documents, whether it's in guidelines, or whether it is in social media, we are everywhere, because everywhere we need to be. So 41,000 RNs, NPs, and nursing students that voluntarily want to belong to this powerhouse to create a social movement. And yes, colleagues, a social movement we have created. People that have been for years, like Paul Andre, people like Hilda Swirsky, people like Marianne Cochran, and so many that I have seen year after year after year coming to the AGMs, out of the commitment, the passion, that they have for this organization. What can I tell you? If that cannot fill me of pride and you of pride, I don't know what else. And we have you covered. This year, we delivered for you the best program to have you covered, a program that hopefully never you will need to use. But if any time you do, you have a program that have you covered like no other program that exists. So members that work in all sectors, in all roles, that are everywhere with values, evidence, and courage, produce results in numbers, in policy, and yes, also in finances. And our finances, as I must report to you, and you will hear more, are absolutely very healthy. So it is not wonder that then you come to an opening ceremony and the minister has a list of announcements, and it is no wonder that opposition parties have a list of where we fit together, and we just need to dream big. So let me end the dream big with two things for you. One that I promised last year. Last year I committed that we were going to do something about this RN replacement. So on Monday, and you're the first to know the title finally, my board very much wanted to know the title, and even they don't know the title. But they do know something is coming. And they know the content. On Monday at 9:30 in the morning, and you are all invited to attend Queen's Park, because if you do and do RSVP, we will have an overflown room for you, and the more you come, the better. We are going to release a report, I will give the title at the end, that will speak about a narrative of 3 layers. The first is an analysis of the minister's reports on Patients First. The minister released 3 reports. It's an analysis of those reports, and basically the conclusion is, yep, we agree with you. It mimics ECHO. We wanted to move there. We are totally on side with you. And then it brings 2 more pieces of analysis. One is a health human resource analysis, and it gives sector by sector what's happening with RNs, RPNs, and nurse practitioners. And then it's an analysis of models of care delivery. You know those old names like primary nursing that are difficult to find these days, and makes the analysis of functional nursing, sometimes called these days collaborative practice, sometimes called these days team nursing, but really functional nursing, and provides the 3-layer analysis and comes to the conclusion, Minister, you have it wrong. While the path is the correct path, you forgot the fuel that will let you get there. While the path is the correct path, unless you have a comprehensive health human resource strategy, you will not get where you want to get with the best of intentions. And here is the first installment for the Interprofessional Health Human Resource Plan, Minister. We are releasing for you today a report called Mind the Safety Gap in Health System Transformation, reclaiming the role of the RN. That is coming on Monday. And now you can put it on tweet before you see it in the newspapers. The second is another good piece of news, because I like to make promises at AGMs. And I don't know if my colleague Linda Aslam is here. Linda, are you here? I don't see her. Okay, Linda was going to be here, so when you see, you can thank her. First of all, you can also thank her on the independent RN prescribing, because actually ONA was extremely supportive and supported independent RN prescribing. But the second one is an initiative that ONA supported that will bring you a legacy for this province, for registered nurses and for RPNs. But I am going to only speak about the piece of RNs and nurse practitioners, which is the piece that belongs to RNO. There was a fund at one point called the Nursing Retention Fund that was created out of a kerfuffle that we did with Minister Smitherman when he had the audacity of announcing that 747 nurses were going to be laid off, and I kind of off the cuff, when the Toronto Star called, said that's the crashing plane of the minister. And then Ona did also something, and next morning, here we are, and the minister says, I'm going to put a stop to this noise. And so he created this fund, but the restrictions of the fund were such that never it could be used. Very little of that funding could be used. The closing clause had been for several years, and every time we postpone and postpone and postpone, but the money still was not being used. And the money was distributed then on the proportional parts to RNO and to RPNO. What RNO is doing with it is creating a legacy heritage fund. The interest of that fund will be used for a very solid program that will be used for research, education, and practice to bring practice, education, and research together into activities every single year, starting next AGM, where we will launch the program, because we now need to set the small infrastructure for it, and from there, forever and ever and ever and ever for generations to come. So, Veronique, where is Veronique? You were very concerned about research funding. Okay, you can a bit relax now. So that's the last piece of news that I wanted to give you, and be assured you will hear more next year when we launch the program. Colleagues, I thank you. I thank you because together we produce results. We will be the first jurisdiction in Canada and in the world, except of UK, that will have independent RN prescribing, no list, no protocols within scope, with an interprofessional course for doctors, nurses, RNs and NPs, pharmacists and midwives to take it together so we learn to respect one another. A program that hopefully will become, in years to come, part of the curriculum that will serve both RNs and CNSs, so will also help to resolve at least some of the challenges that clinical nurse specialists are experiencing of not being able to practice to their fullest potential to support patient care. So with that, my colleagues, let me tell you, there is absolutely nothing that can stop this RNO, nothing that can stop you guys anymore, which is beautiful. It's beautiful. I have only one request: dream big and give us those dreams, because we will make them happen. Your board, your staff, and you, we will make those dreams happen. Thank you very much for another year of success. To you. To you.